All right. Welcome back to the Progressive Rehab and Strength podcast. I'm your host, Dr. Rori IG, clinical coach here at Progressive Rehab and Strength with my lovely co-host, Dr. Alyssa IG. And we are, well, actually, she's also a clinical coach here at Progressive Rehab and Strength. And we are back with another 10-minute tip Tuesday. And in this 10-minute tip, we are going to be talking all about deadlifting with back pain. And one of the most common misconceptions is that if you have back pain, you shouldn't lift. If you have back pain, deadlifts and squats will make it worse. If you don't have back pain, squats and deadlifts will give you back pain, which is not true. But this episode is coming in a whole month series on low or just back pain in barbell training and powerlifting. So if you are catching this podcast and you're interested in learning about the back and barbell training, you should check out all the other podcasts that we have related to the back and barbell training coming out in March 2023. So with that all said, with a 10-minute tip, we set a timer for 10 minutes, which I did not set up in advance. So I'll do that right now. And we discuss this topic, give you tips, tricks, and shiz to help you manage it. And usually when that timer stops, we often keep going because we are bad at keeping things to 10 minutes. So with that all said, I'm going to hit start on the timer set for 10 minutes. There we go. Alyssa, can you talk to me about, or to us about back pain when you're deadlifting? So kind of, I guess the first thing that we should discuss is, where in the range of motion are you experiencing pain? And also, are you experiencing pain only at heavier sets, or are you also experiencing pain at super lightweight, like your first, second, or third warm-up set? So why don't you go ahead and chat with us about that?
Yeah, and really the answer of what to do depends.
Depends, as
It
it
always
always does.
depends. There isn't one right answer. It's really going to be about finding what works for each person. When we're talking about back pain and deadlift, yeah, it can arise at different parts of the movement, and where you're feeling that pain is going to likely affect how you address it and how you continue to lift, really, uh, while addressing your symptoms. So the first question is, are you having pain off the ground? Are you having pain at lockout or towards the middle of the lift? And are you having pain just bending over to put your hands on a bar with, well, forget how much weight is on it. Are you having pain just getting down to set up?
Right? Oh
And
God.
then are you having
Raise your hand if that's ever happened to you. I'll raise two.
yeah, and then are you having pain just lifting or breaking the floor with 65 pounds, 10-pound bumper on either side of the bar, or as you get to heavier weights? So if the pain is happening from the ground and if it's happening just at heavier weights, then maybe we can stay at a weight that is
Hmm.
just below that threshold of where that pain starts and then gradually progress that. If you're having pain off the ground, and it doesn't really matter what's on the bar, or, the lightest weight that you can load the bar to is on the bar. And side note, an important part of that is that you're using bumpers. So putting
Hmm.
10-pound plates on the bar and sitting the bar on the ground,
Like 10-pound metal plate, so
yeah, that's
smaller than a standard 45-pound bar
that's going to
plate.
place the bar too low.
Hmm.
And if you need to do that, then you should elevate the bar to about mid shin height so that it's at your
Hmm.
normal height. So we're talking about 10-pound bumpers. So the bar is basically sitting where it would sit with 45s on either side. If that is an issue, then we're going to raise the bar and
Raise the bar.
and and place it right above where you are having symptoms. So find that
Hmm.
range where you're comfortable setting up and starting the lift. It could be a rack pull or a block pull, and progress the weight in that range. And then when we lower the bar, increase the range, we can lower the weight, progress the weight, and then so on.
Yeah, and I think another exercise or supplemental lift you can use for if you have pain off the floor is also the RDL.
Hmm.
But I would argue to start with a rack pull, because we start from a dead stop in the bottom position. So the RDL is less, um, what's the term? It's not the it's further away from the main lift than a rack pull is. But you can use either of those. Those are the two I guess we would recommend the most if you've got pain off the floor. What about if you have pain at lockout?
Yeah, so pain at lockout, again, we have to consider, is it a heavier weights? That rule kind of applies to both situations.
Mm-hmm.
So, but if you're having pain at lockout, no matter the weight on the bar, first we need to consider like your head position, your neck position, how you're breathing, are you wearing a belt? And that's if you're not wearing a belt because you're lifting lighter weight because you're having back pain, put
Mm-hmm.
it on. It's going
Yeah.
to give you support and just a little bit more security while you're lifting as
Yeah,
well.
and a little bit m- um, more assistance with creating that Valsalva maneuver, which we'll talk about shortly. We'll talk about belt breathing and bracing when you've got back pain. Um, so, what lift would we do?
We could do a halting deadlift
Mm-hmm.
so that we're not going into that end range of the deadlift.
Mm-hmm.
Um, and again, finding a load that is comfortable, stopping before you get to that range of significant increase in discomfort or where you're feeling those symptoms. And then work on progressing the weight and then,
Then lowering it over
yep,
time. The other thing, and I think I use this very rarely. I will mostly use a halting deadlift if you've got pain at lockout. But one thing that you can kind of add into the mix um, if you're using the halting deadlift and you kind of feel like you need a little bit more volume, you can try adding in a barbell bridge. So, not a barbell hip thrust. I think that range is too large. So, a hip thrust is when you're elevating your shoulders on a bench, but a barbell bridge is when your shoulders are on the ground. And the reason, even though that it is hip extension under load, it's in a gravity minimized position, meaning gravity isn't pushing down through your spine. So sometimes people who have pain with extension or at the lockout don't have that same symptom when they are lying down. So um, if we want to train hip extension, loaded hip extension, um, when we can't in a standing position for the deadlift, we can also bring in the the barbell bridge. Again, like I said, bridge versus hip thrust. I like that it's a shorter range of motion. You get a lot of hip flexion, spinal flexion in a barbell hip thrust when your shoulders are elevated. I have a question for you, Alyssa. I'm curious because I don't actually think that we've ever discussed this together. So I'm curious to see what your answer would be. And I think that we had this question that we wanted to cover going into this podcast episode um, from like a different viewpoint. So my question for you is if you're experiencing pain throughout the full range, like the pain is not position or range specific, you just have generalized back pain, and it's hurting when you deadlift, you can't pinpoint a range or a spot. Um, what would you do?
oh, it
Aside
depends.
okay, so let's say we've modulated load and it's not load dependent. It's just kind of always there. What would you do?
Well, I would potentially see if changing the movement a little bit, even in RDL, which is the bar,
Mhm.
changes how somebody feels. And it might not. Um, but we could ultimately like pause deadlifting, not pause deadlift. Not a
Well,
pause deadlift.
okay, so I see what you're saying. You would ultimately like take the deadlift out.
If we aren't able to train it without increasing symptoms, without lowering weight, without making any of these
So
changes.
let me give you a little bit more of a clue as to like what I'm trying to get at here. Let's say this person's a conventional deadlifter.
Oh, sumo.
Yeah. So and
I was like
you're like, I don't know what you're talking about. Um,
yeah, so
so
and we didn't really get to that. So sumo sometimes
right. I think it's kind
is
of, we were talking about like range versus this is like not a range issue.
mhm.
And that's kind of when we would say, okay, for the time being, let's try to change just the back angle through the range of motion.
Yeah, and I think that we both have clients actually who conventional deadlift is just like historically an issue for them,
Mhm.
and back flare-ups can happen when they incorporate a conventional deadlift into their program and they're sumo deadlifters because that's what works for them. We tend
Mhm.
to start with a conventional deadlift and
Yep.
prioritize that or keep it in the program for a sumo deadlifter, but sometimes there are people that just do better with sumo and that's the deadlift that they do. So yeah, that's
Yeah.
where, we would move to that obviously from.
Yeah. So that definitely the back angle. I think I don't know when we're talking about this, but we're running out of time here. But we have a lot to cover. But the back angle is less horizontal, more vertical in the sumo deadlift. So if it's not a specific range, or if you've tried adjusting the load, and none of those other lifts work for you, it might, in order to maintain continuing to train the deadlift, you might switch to sumo for the time being. Um, the one thing I want to mention before we move on to breathing, bracing, and belts is head position. So, a lot of times when people lock out the deadlift, they drop their head down and their chin tucks. And they don't do this like intentionally, it kind of just happens sometimes. But when we have irritation along the somewhere along the spinal column, the cord, the nerves, our timer's going off, but we'll just keep going. Um, we can get dural tension, and when we tuck our chin or drop our head down, it can, so the nerves that are so sometimes nerves get John, we have a podcast that's coming out before this which talks about the functional anatomy of the spine. So if any of these terms are confusing to you or not familiar to you, definitely go listen to that episode, and you can watch it on YouTube as well, because on YouTube we put images with all of this stuff. But basically, we have the brain turns into the spinal cord, which goes through the whole spinal column, and off of the spinal cord we have nerve roots that or nerves that extend out from the spine, and all of that is encased in one casing. Basically, it's just kind of like got this like casing around it. And if there's inflammation in one area, when you move another area of the nerve or the spine, it can cause increased irritation in that area as well. So sometimes when people drop their head in the deadlift, that could be contributing to their symptoms or the lack of lessening of their symptoms. So when we're trying to calm symptoms down, might not be an issue on a regular basis. Like, sure, tuck your head. Like, I don't care if you don't have symptoms, right? But if you're having symptoms, we kind of want to control all the things that might irritate your symptoms. So definitely check your head position at the lockout of the deadlift, because that little chin tuck could be flaring up your back. And I'm actually working with a client right now who I'm doing all these things. Conventional deadlifter. And for his back issue that he came to me, he got very bad sciatica shooting down his leg. We went to a sumo rack pull, and I also found controlling his chin position, and he's wearing his belt on like all. We started super light, like maybe like 135 when he's a near 400 deadlifter. So like we incorporated all of these things into that. So head position, don't neglect it, especially if you've got a flare up. Talk to me or us about breathing and bracing, especially when you're injured, when you've got a back issue.
Yeah, so how you're breathing and how you're bracing matters, and it could be contributing to your symptoms or lack of symptom resolution. The best thing I can say is that not we shouldn't be doing anything different once the belt is on.
Mm-hmm.
So we run there's an a kind of an older mindset of you should breathe into the belt, push out against the belt.
Mm-hmm.
Um, and that really is not going to create the core tension and support that we want. In fact, that could be more aggravating
Mm-hmm.
than the alternative. So, if that is something that you're doing and you're having symptoms and you're like, okay, well, I'm really trying to brace really hard, and that's how you're bracing, it might be
Mm-hmm.
making matters worse. So, breathe, take your air in, and hold your breath. like you
Don't push your
would.
belly into the belt.
Like you would if the belt wasn't on.
Yeah, exactly.
So, you're gonna breathe the same way, you just have more support from the belt.
Yeah. Well, we're gonna have I think it's coming out after this. We're gonna have a whole episode on the Valsalva maneuver. So and belt breathing in belts, and how it helps your back. So definitely check those two episodes out.
One thing I
Um,
wanna add
yes.
is that though it is not so going back to the sumo and conventional, though it's not the most common scenario, it can happen if there's somebody who only trains sumo or is like a sumo deadlifter and happens to have back pain with sumo, you might want to try conventional at least temporarily while you're dealing with that. Again,
Mhm.
maybe that's not the most common scenario, but I've been in
Mhm.
that situation.
Mhm.
So, you know, if you can do something, even if it's not your stronger main deadlift,
Right. Exactly.
train something and then work on resolving the symptoms and maybe adding that back in.
Yeah. Yeah, definitely. I mean, I think that a lot of that has to comes down to like the hip musculature
Mhm.
and um you know, and also load. Sumo is generally heavier than conventional, and we have more hip external rotation, which can compress the SI joint a little bit more, recruits the hip musculature in a different way, and can compress the nerves in the glutes and stuff like that. So, um, yeah, there was one other thing that I wanted to say, which I'm totally forget. Oh, back to the breathing and bracing thing. One thing that I see with a lot of lifters when we're dealing with back pain and trying to resolve it is that they'll always make this comment like, if I really focus on bracing, I can reduce my symptoms. And, sometimes when we're warming up or we're using lighter weight than our general training loads, we don't treat it the same way as a heavy load. So we're not really thinking about our bracing. And not that we need to think about bracing, but we're just not, in general, we don't need to think about bracing. It's something that happens automatically, but we just don't focus on form as much. We don't uh we don't execute a valsalva for every rep. We sometimes breathe in and out while we're lifting because the lights are super sub maximal, so a lot of times people will um say that when I really focus on my bracing, my symptoms reduce. So that goes to show that we should be always focusing on our bracing, especially when we're trying to recover a back injury. So, anything else you want to add, Alyssa?
I don't think so. I think that was a 2 times 10-minute tip.
Definitely, that was way too long. Sorry, guys, but hopefully you found that valuable. The back is it's one of the most. It is the most commonly injured area in life, lifting, and other sports. So, all right. Thank you for joining us. Thank you, Alyssa, as always, for being here. And if you have any questions, you can join us in the Secret Society of Barbell Mastery for a free form check. You can book a free consultation with any of the PRS clinical coaches. You can submit questions and topics or guests that you want us to have on the podcast. All of that stuff is in the show notes. We'd love to connect with you guys. So get in touch with us and we'll talk to you guys next time.